Awesome. Welcome. Thank you so much for joining us for our hormone roundtable. This is Marcus Bechstein, endocrinologist, and I am Dr. April Schulte, doctor of acupuncture and oriental medicine. And recently, Dr. Bechstein and I have come together to bring our expertise together in a way that helps us understand how we can answer your questions, because certainly I am used to seeing a lot of clients who have specific questions about their hormone picture and not sure if they want to pursue a traditional route of care or more traditional Chinese medicine or just completely natural or just rough it out or what. And so we would like to educate you and help you educate us with your questions as well on how we can help you answer questions you may have around your own health. Yeah.
That is right. And so at this point in time, it's all just a question of trying to find out how we can help the individual. It's not a rubber stamp. In traditional medicine that I've been practicing for more than 30 years, you have certain rules and regulations, and they are basically quite inflexible. And we need to be sure that at this point in time, people understand that we do provide flexibility here. That involves a lot of people that are in that gray zone where the medication that we prescribe as regular practitioners is way too strong and people have side effects from that. And jumping right into hormone replacement therapy, that involves even cancer generation, and that's really not a good thing. When you're talking about trying to help somebody who is quite healthy and give them a medication that potentially can cause cancer. So we are able to get away from that and work on principles of what fits the person that is in front of us the best. And as you probably have noticed in our traditional medicine, everybody is time pressured these days, and they don't have the luxury of sitting down and trying to find out what that particular person is all about and how we can help. They just reach for the medicine cabinet and get you going on your way, and then maybe a month or a week or whatever later, they will ask you, hey, is this working for you or not? And if it's not, and it's already the lowest prescribable dose, then the question is, what can you do? And a lot of patients or people are in that position where, the medication that is FDA approved and that we know how to prescribe is not quite fitting the bill. And so having us here is, I think, a much better solution.
I also thought it would be good to give a pretty basic definition of what hormones are.
Mm-hmm.
And also, could you explain what is endocrinology as it pertains to Western medicine?
Yeah, so endocrinology deals with the hormonal systems in our body. Obviously, besides estrogen and testosterone, there are plenty of other hormones like insulin, thyroid hormone. All these type of hormones are under the umbrella of endocrinologists with regards to the approach that we can take. Endocrinology then basically means hormone medicine, and hormones are a way of communication in the body. So we have the nervous system that is, everybody knows, the hard wiring in our system that makes a lot of things function. But we also have the hormonal system, which means there is one area in the body that secretes that hormone, and it tells a remote area in the body what to do. So it is hormones get secreted and moved to the target areas through the blood system. So we have the electrical system and we have the hormonal system. And they all have to be in balance, obviously. So hormones are a good way of communicating. If you look at your body, you have about 30 to 50 trillion cells in there. And all of these cells need to work together. If they don't, then we get sick and something is broken or we need help from the outside. So It is quite important to have all of these systems in balance. And when we see people as traditional practitioners, there's something broken already most of the time, and we have to try and fix it. That is sort of a little bit on the late side as far as I'm concerned, and it's always sad to see that people have gotten to that stage and we have to pull them back out of that if we can. And sometimes we're unable to do that, and that is one of the reasons why I am venturing into new realms of practice, because there is a lot to be said about what Dr. Schulte is doing here for you guys. So
After 21 years in practice, I love it when I get like little light bulb moments, and they still happen, and I just had one. How many cells do we have?
about 50 trillion.
About 50 trillion. And then he said, it's important that they all communicate with one another and they work together as one. And that is certainly how Chinese medicine, for sure, and even functional medicine tends to look at the body as a whole. Instead of breaking each system down into a little microcosm of what we're going to treat, for example, you have a lung doctor, you have a kidney doctor, you have a heart doctor, you have a hormone doctor, you have a nervous system doctor. Instead, we really try to take an approach of seeing how all of the organs work together as one, together with the nervous system, the endocrine system, the immune system, our emotional health, the environment. When we really start to tie things together as one unit truly, with their environment and within ourselves, with our spiritual self, our emotional self, we have so much power. We gain so much power in our own health, right?
That is absolutely correct, yes. So the balance is important for the body and makes it work appropriately for us, hopefully for all our lives, until we have to go somewhere else.
So we actually could discuss hormones by ourselves for hours and hours. But since we're none of us here for that, do you have specific questions that you would like to ask us that we could speak on? Any of you have specific questions? Yes, Mr.
Well, I'm kind of happy this is happening because I'm not only broken, I'm like upside down because, between your TSHs that are always normal and you don't feel they're normal. And when they say, well, you ask the doctor, well, can I test my hormone levels? Well, no, it's really hard because you never know. At 8 o'clock in the morning, it's one thing, and then 9 o'clock at night, it's another. So you never get balanced out. You don't know. I was on estradiol and progesterone for a while, and I don't know which one of them kind of made me aggressive, but it did. And I am just really upside down. So I'm just anxious to see how this is all going to work.
So we'll repeat your questions just so you know, because we're recording.
We are hardwired. Yeah, so the question of if you are on a regimen and it does not work for you, what are you going to do? That is what we're here to help you out with. Because, like I said in the beginning, as regular practitioners, we have to abide by rules, and we have to prescribe medications that are FDA approved and so on. And all of that is inflexible. So you slip through the cracks with regards to your symptoms because that's absolutely not necessary. And there is a good chance with a manipulation downward of some of these hormones, you're going to feel like $1 million again. And that's what we're looking for. Yes.
I would like to speak. You initially said that your TSH, your thyroid stimulating hormone, did you say sometimes it's high or sometimes it's really low? You don't know. Oh, they always say it's normal. So a normal TSH, and yet you feel like maybe it's not normal based on your symptoms. And I really prefer to treat the thyroid symptoms based on how the patient's feeling. So how does the patient present to me is how I decide I'm going to address the client. And of course, I don't treat the thyroid itself because I'm not a medical doctor. I'm not an endocrinologist. So I'm not going to be prescribing hormones. However, if I feel like that's maybe appropriate, that's why I love having my trusty colleague here. But I do think it is important. And we've actually been collaborating with a few clients on this exact topic about how when a client shows up, and classic signs of hypothyroidism are usually fatigue, hair loss, constipation, feeling really sluggish, low energy, slow digestion, and depression, right? And if you feel that badly, A, it may not be your thyroid. B, it may be your thyroid, and you may still have a normal TSH. And I'm going to venture a guess that's when we need to get some more deep blood work
Right.
than just the TSH.
Yeah, talking to people like me, a normal number might not be normal for you. How is that taken? You take people off the street, you get their blood, you look at their variations in the numbers, and you say, well, they're all healthy, so that all must be normal. And now we're going to say this is the cutoff and that is the cutoff. It's quite arbitrary. And I tell you, for instance, for pregnant women that have to share thyroid hormone in the beginning of the pregnancy because the baby doesn't make it yet, you have different sets of rules. So normal is not normal. They also are talking about shrinking that normal reference range, especially when a TSH is over 2. And some of my colleagues, including myself, if I hear a story from you that sounds like the thyroid and your level is higher than 2, it's supposed to be allowed to go to 4. I don't see a reason not to try and see how we can help you with thyroid hormone to identify if that is the cause. So the rubber stamp approach, again, this is the normal cutoff. And if you fit into this, everything is normal and it's all in your head, is just not very valuable to the patient, honestly. It actually demeans the patient. Hey, here I have scientific evidence that you're normal, so look for something else that causes the problem. Not a good approach. Yep. So what we are trying to do then in your case would be the question, have you tried, for instance, microdosing, which means, you're not at the full strength of the medication, but it might give you improvements of your symptoms already. So why expose yourself to a drug at a high dose if you only need half of it, especially if it's associated with cancer generation? So microdosing makes a lot of sense. And then you can go even further and say, why don't we start with herbals? We know a lot of that. And acupuncture and. There are so many different routes to help you. Non-pharmacological, which is not going to have side effects from the medication because you're not taking it. So our approach here would be to try and find out the least necessary intervention from our part to make you feel perfect and not overshoot.
I do think hormones can be very confusing for us all because as the main communicator of the body, or one of the main, really, just one of the main ways the body has the miraculous way of communicating, it helps to know that we can optimize our health in general by kind of looking at what does each hormone do in the body and translate that through the lens of Chinese medicine. For example, when we talk about estrogen, it really has a lot of qualities in the body that mimic what we call yin, okay? And we have in Chinese medicine, we talk a lot about yin energy and yang energy. And we want the two even in the body. And one of the things I do when a client comes in and sits in front of me and we're discussing chief complaint is try to figure out what is the balance in that particular body, that particular person, their yin and yang levels. And to make it a little more complicated, just so you know, we can break yin and yang down into each organ system as well. But just to keep it sort of simple, Chinese medicine 101, we have yin and yang levels in the body, and we want them even. We want them even in the body. Now, often, if someone comes in with yin deficiency, okay, that's called this one yin, then yang energy symptoms are going to be prevalent. And what that means, if we consider yin energy as female, as down, as nourishing different body fluids, like blood, synovial fluid, even the myelin sheath that surrounds a nerve cell that helps nerve conduction, blood, and just general flexibility in the tissues, like the fascia, the connective tissue. We want that nice and moist and supple. We would call that yin. Yang energy is opposite of yin. It is male, it's daytime, it's functionality, it's the ATP production in the cell, it's qi, it's daytime, it's summertime, and it's warming, okay? So if someone comes to me and I determine that their yin is low, then symptoms that they're most likely going to be complaining about are things that go up. So that would be like hot flashes, very common, hot flashes, or insomnia. It's what happens in the 24-hour cycle. The nighttime is the yin part of the 24-hour cycle. We want enough yin energy to suppress the yang energy so that we can sleep. If we are yin deficient, we don't have enough yin to suppress the yang. The yang pokes through, and that's why we have insomnia quite often. It's not the only reason, but it could be one reason. It's also why we tend to have more hot flashes at night, or why we might tend to have more anxiety at night, or why our inflammation feels worse at night. And so that's just one contributing factor. And that causes a variation in symptoms in the patient. So also, let's say both yin and yang are down, okay? And yin is even lower than yang. We still have more heat, even though yang isn't enough either. We still have more yang than yin. We call this a deficient heat situation. However, let's say yang is normal, okay, and yin is down. That's just heat. Let's say yin is normal and yang is higher. That's called excess heat. Let's say yin is normal and yang is lower. That's called cold, true cold, okay? And so I'm thinking about all of that. And the reason why I'm taking all this time to explain it is that from there, often we don't need hormone replacement to get those yin and yang to be balanced in the system. We can use food as medicine. We can talk about our behavioral health and our habits. We can use acupuncture and different therapies that even Dr. Bechstein is offering now, having to do with the energy fields. When we start putting all of that together, we can bring yin and yang into balance pretty well without medication, pretty well. And so to me, that means that we're able to bring the system to a place of balance without hormones. Not to say that sometimes hormone therapy is not needed, and it's important that each of us sort of decide what's best for us as clients, as patients, that we are the directors of our health ship. What's the actual analogy? What are you on a cruise ship? What?
No, I don't know, captain. But
yeah, captain. You're the captain of your own health ship, right? And there you can sort of decide, well, I've kind of done all the things that I might need some extra help, or I'm actually miserable right now, so I don't have like 2 years to nourish my yin and figure this all out. Maybe we'll lean on the hormone replacement therapy at first, so that kind of give us some breathing room.
Mm-hmm. Right. And the important part that Dr. Schulte was talking about is the energy, yin energy, yang energy. That concept is completely absent in traditional medicine. And that is my new frontier. And just listening to you is so awesome because at this point in time, I understand that the energy is the basic principle that we're dealing with. And there is refinement of that process with regards to where the energy flows, how much energy do you have, all these type of determinations were not part of my upbringing, so to say. And so that is a new frontier for me. And that new frontier is, as I'm learning about it, I'm also understanding that we now have instrumentation that can capture this type of energy and give us an understanding of where you are with your total body energy and so on. And that is one of my new frontiers. Like I say, I have these instruments available so that if anybody is interested in your total energy content, how it courses through the body and so on, we can now measure this. And that is the bridge that I'm exploring between what Western medicine has to offer and what Eastern medicine has to offer. And a lot of my colleagues are shunning that at this point in time, although there is over 50 years of scientific experimentation, which is the basic principle of what all physicians are trained to look at and understand and realize. So it's shunned despite the fact that there is a clear-cut influence on our health with regards to the overall energy.
Before we leap into that at a deeper level, do you have any questions now? Yes.
What's the best route to get your hormones checked? Because I'm looking to do that soon.
That is an excellent question. We may have different answers. Go for it. Okay. So if we are speaking, of course, I'm guessing you're speaking about sex hormones, so estrogen, testosterone, DHEA, and so on.
Well, if I can elaborate, I'm getting my IUD out, and I just also am on medication for, anxiety and whatnot. So I'd like to get off that as well. But I'm sure me being on birth control since I was like 16 has made a huge impact. So I'm trying to start there.
Great question, and thank you. So the question was, having been on birth control, especially and some other medications, how to sort of tease out the best way to test hormones to help you make a decision. And in that case, birth control, and let's just actually take a minute to talk about the menstrual cycle in general. The menstrual cycle is such a great mirror as women for us to understand our health picture. And even if you're postmenopausal, I will often get a menstrual cycle history because it still gives me a lot of information about your health in general. So when we use hormones, particularly when we use birth control, it takes away our gauging system of what is going on in my body. It sort of takes that away, and we aren't sure exactly what would be happening if we weren't ingesting the birth control. So I would probably, and everyone's going to be different, but if someone wanted to really come off their birth control, I would have Dr. Beststein help me, since I don't do medications myself, titrate down on birth control, or maybe decide to stop birth control. It'd be interesting to hear your perspective on this. Mm-hmm. And then I like to test hormones in saliva. And the reason I prefer the salivary hormone test is because we usually get to track the hormones over the course of a day's time. Because as Rin brought up in the very, very beginning, your hormones are supposed to have different levels at different times of the day. And so when we do a blood test, I know specifically some blood tests you would recommend be done at a certain time. Because we're looking for certain, like even during the menstrual cycle, we sometimes want to see, say, a progesterone between days 21 and 23, I think it is. I like to see what's going on throughout the day because the hormones are not separate from one another. They work together in concert with one another. So we get to see what each hormone that we choose to test are doing together at different times of the day. And that just gives us more information than a blood test that's a little tiny snippet in time to make that answer shorter, long.
You do that here then?
Yes, we offer saliva testing here.
Yeah, so just to take one step back with regards to female hormones, the cycles are basically dictated by two major hormones, estrogen and progesterone. Estrogen grows the lining in the uterus. Progesterone keeps it there. And if there's no implantation of a fertilized egg, both of those hormones will drop and the cycle is complete. You will slough that lining, and then estrogen starts back up growing a new one, right? So that's the basic principle behind menstrual cycles. When we use hormone replacement therapy, which is basically what we're doing, is we're putting your system to sleep, and we are giving you the medications that are necessary to mimic that, but in a higher level of dosing than you did make. And so we can basically correct the irregular cycles with lots of cramping and so on by putting you on these medications. And so mission accomplished. You came in with a problem. Let's say you had a lot of cramping, or you had a poor menstrual cycle, sometimes prolonged, sometimes shortened, and so on. And so we can just basically let you take this pill and do it according to the blister pack, right? And the sugar pills, the last one, is basically where both of those hormones will drop, and you will slough everything, and the cycle begins again as you take the hormone once again. The problem with that is if you make your system go to sleep, sometimes it takes a while to wake it up. And that's where, women that were on birth control pills for years want to become pregnant. And now they're taking their birth control pill off, but their system is not kicking in. And that's obviously a very sad situation. But depending on the length of putting your system to sleep, it might take a while to wake it back up too. But typically that is achieved. Now the question is, are you going to be in the same predicament that you were in when you started the birth control pills? Is this going to be problematic? And that's when we are here for the rescue, because we can fine-tune this.
I would say not if I have anything to say. No, I have anything to say about it. Actually, we can wake up the system. And I like to gauge that with basal body temperature charting. And based on how that chart looks is kind of gives me an idea how long I think it's going to take to wake up the system, so to speak. And that's in general, when we think about hormone replacement, so important to think about. Do we believe enough in our bodies they can achieve balance without extraneous medications or not? That's our belief systems. And that we all get to ask ourselves, how much power do we have as an individual to regulate our own health?
Yeah, so most of the time I would venture a guess. The reason for irregular menstrual cycles, pain syndromes, all these type of things are the person itself and the environment. Where are you in your life, and what is happening, and how much does that impact you? You got to remember that with guys, the same thing. Testosterone levels go down if stress goes up in their life. Why? Because stress causes injury in the body, and that needs to be repaired. Your body looks for energy if it's already depleted because you've been battered with stress. Then in that particular instance, the body says, we don't need this system. It's immaterial to, right now you don't want to become pregnant anyways, and it's going to take that energy and use it where it's needed in the body. Principle of resource allocation. And so at that point in time, it is important to know the trigger factors for your situation. If that hasn't been there since the beginning of your menstrual cycle, something started influencing it over your lifetime, and that needs to be teased out. Unfortunately, there are some people that do have true disease, and the system is not working. And that's when we reach for hormone therapy, because you need to be able to go on with your life. But the point here is that the rubber stamp approach is just not very fine-tuned to many women that complain about these type of things. And again, it's the same in guys. The testosterone levels go low and they start complaining.
So how would you know, like how she said, when should she take the hormone tests? Because it's kind of the same. I mean, I'm not like her in any way, shape, or form because I've had a full history.
Mm-hmm.
So, but trying to find out when is that right time? How do you figure out?
Such a great question. When is the right time to test hormones is the question in someone who is looking to get off of birth control. And of course, every single client is different with different needs. If the client is not worried about pregnancy, I would definitely encourage the client to go see their doctor, have them removed from their birth control, and just see where things are, which can be and I actually wouldn't test hormones at that point at all, to be honest with you. Usually I would recommend that we take a more general approach from the Chinese medicine standpoint that I was talking about. What can we do to bring the system back into balance? And then if we want to test hormones, do that, because it's not cheap, right? It's not cheap to take all these tests. And it's not going to give us a true picture, especially if we're just getting off of birth control. And I can tell by a basal body temperature chart, which your basal body temperature is your temperature first thing in the morning. And I even will have postmenopausal women do this too, because it gives me a lot of information. Like I said, our female reproductive system, truly, and men too, our reproductive system is a great mirror for our health in general. So I wouldn't recommend testing at first. Now, let's say I have a client, though, who's a fertility patient, something I specialize in fertility, and they really want to get pregnant, and every pregnant woman or woman who wants to become pregnant wanted to be pregnant like a year ago, like couldn't get pregnant soon enough. And so I would recommend testing hormones if I get stuck and I'm looking at their basal body temperature chart and I'm like, wow, why isn't this changing the way I would like it to, using Chinese herbs, food as medicine, behavioral health, and so on. And then often things like avoiding coffee and alcohol and sugar, you wouldn't believe what that does for a person. And so
So sad.
at some point, I might, like, for example, I have a current fertility patient and her basal body temperature is so low. And I'm like, hey, Dr. Veststein, do you think we can check a few things? Oh, yeah.
How do you check for the basal body temperature?
The basal body temperature, she's asking, how do you check for basal body temperature? And there's a specific thermometer called the basal body temperature thermometer that you take your temperature as soon as you wake up before you get out of bed. However, if you want to make things easier, they make these handy dandy little rings now called the Oura ring. There's other ones out there, but I like the Oura ring. And you can sync it with something called the Natural Cycles app. You have to do nothing, and it records it for you. Makes life so much easier. It's very interesting.
Well, how much is one of those rings?
Well, that's a good question. They go on sale sometimes. And actually, if you're truly interested, let me know. I can give you a link so that you can sign up and get some sort of discount that I have since I'm associated with them. Yeah. So, but yeah, I think mine was like $250.
Not too bad.
Yeah.
Has the overall health.
Yeah.
So hormonal testing on hormone replacement therapy is obviously going to give you the results of what you're taking from the outside, right? So the most important feature there is, if you want to know what your body is doing, you have to say goodbye to the external supply. Then you check it, and with regards to these cycles that I mentioned before, estrogen first and then progesterone and so on, I can do the lab testing basically at any time and tell you where in that supposed cycle you are. And there is cycle arrest problems where people have the lining and they just don't get rid of it. So there are multiple different areas that we can home in on with testing at the time, as long as there's no more external supply.
And talking about this out loud, it'll be fun because if we take the basal body temperature, I can usually tell where there's ovulation or not. And so we can have a clearer idea. Are we in the follicular phase or the luteal phase? And then he and I could like totally sync up, and then you'd be like, looks like we need to order on that day. So that's another benefit. Sorry, we'll come back.
Go ahead. I had a question. I'm on oxygen at night, and I've had a hysterectomy. So how is this going to affect me taking my temperature in the morning? Is it going to make a difference?
So the big question there is, first, hysterectomy, okay, but the ovaries are responsible for the hormone situation. So that would be the first question there. And so once you don't have those anymore, then yes, you do not supply your own hormones, except the adrenal gland is basically responsible for the production of hormone postmenopausally. So women continue to make estrogen and testosterone and so on, and that's then a different organ system that takes over when the ovaries are not present anymore. Postmenopausal situation is very similar. The ovaries are not doing their job anymore, so you rely on the adrenal output of these hormones.
And that was to work with that morning temperature.
Yes, my educated guess about the oxygen question is it would not necessarily affect it, but I don't know for sure, and I'd want to research that.
Well, the most important feature there is that it's supplied correctly and you have a good night's rest and so on. So if you're on a CPAP, which it sounds like, or maybe just supplemental oxygen per nasal cannula, that has an impact on your sleep pattern. And because of that, you will be able to try and see how it does without hormones first and see where we are, and then start from a low level and go to the amount that you need rather than using the big old approach and winding up with problems in the future. Cancers, blood clots, all kinds of things are associated and should be told to every woman that takes estrogen, for instance. And so the risk-benefit ratio has to be right.
You have another question?
Sorry, I'm planning on removing the IUD on Tuesday. So would you recommend doing a blood test first and then after that looking at the basal body temperature, just starting with that?
Well, IUDs come in different forms, and some of them are drug-eluting, is what we call, which is basically a hormone that is coated onto that device and slowly leaks out and slowly gives you that hormone. So if that's one of those, then obviously, again, there's an external source that we will test, and after removal, we won't know how the levels are going to be. So I would not do testing prior if it's a drug-eluting IUD.
I agree. I would wait.
How long?
So again, that's going to depend on sort of how is your body doing. We don't know what your body is going to do with the IUD removed. So we would want to observe and watch and take your basal body temperature, listen to your body. How are you feeling emotionally, physically, mentally, and then watch your body temperature subjectively too. Sometimes you might feel hot, you might feel cold, even without a temperature. And then track your symptoms. You might, possibly you might have headaches, or we might have more menstrual cramping, or we might have mood swings, or all the different things, breast tenderness, all these different things. Track that. And then you can sort of put that into a logarithm for yourself to decide what you want to do to bring that into balance, and then test your hormones. And while I'm thinking of it, because I don't want to forget, a lot of these resources are at my Mother Nature's Doctor website. Yeah. And there's free tools on there. If you have any questions, just let me know too from there. But I would not go through the trouble, honestly, of testing your hormones at first. I would just wait and see how you're feeling and go from there, and have the belief in yourself that you know that you can figure out the answers as you go, but there's no pressure to see. And because what are you going to do if you get a hormone test and it's not where you want? Are you going to go back on hormones?
It's just going to change really quick anyway. It's not really quite the outwork.
Yeah, exactly. That's exactly right. Yeah.
So, what is frequently going along with the absence of estrogen is the osteoporosis, right? So over long periods of time, postmenopausally, without the protection of estrogen, your bones become more brittle faster. And it's the same with guys. If the testosterone levels are low, they do develop osteoporosis just the same. So what I have found in my practice is that calcium and vitamin D are very important players with regards to protecting postmenopausal women from the development of osteoporosis. So you do not absolutely need estrogen. And as you might know, we're not supplying estrogen to every woman that has osteoporosis. We're using targeted medication for the osteoporosis and don't deal with the hormone situation at all. And that is something that every woman should consider anyways. Idealizing calcium intake and vitamin D is tremendously important postmenopausal, from my biased opinion, because I see a lot of women that come in that have just blown all this off, and then you wind up a few years later with a fracture of your spine or your hip because nobody has taken care of that aspect of the lack of estrogen in your system.
And look into vitamin K2 to help assimilation. And from my perspective on that front, because one thing a lot of postmenopausal women are going to start to hear a lot about, if you haven't already, is how estrogen is also protective, not only bone health, but also brain health and cognition. It's very, a correlation has been made between lower estrogen levels and those. But however, my perspective on that is in Chinese medicine, we say the kidneys. I go like this when I talk about organs in Chinese medicine, because the Chinese medicine kidneys, they sort of mirror what the Western medicine kidneys do, but they also have their own function. And the Chinese medicine kidneys are a root source of energy, qi, vigor for life. They're that strong base that we stand on. They rule the reproductive system. They rule the bones. They rule the brain. And we can bolster the kidney yin and yang and qi and essence and jing, all the different qualities of the kidneys, so that you can be healthy and strong even without hormone replacement. And of course, that doesn't mean you get to just sit on the couch all day long, because it's important. You've got to still do things to help yourself move, and put stress on those bones while you're taking your supplements and eating well. And you can get so much calcium, by the way, from food, from the dark green leafy vegetables or sunflower seeds. An incredible source of calcium for yourself. And it's really not that challenging to get enough calcium in our body just with diet alone, unless you're used to eating refined foods and not eating, I say, food from the earth.
And this is why I'm so in awe with regards to joining this group here, because this type of information, I never had any chance or time in my life to deal with that and dig into it. Again, just the rubber stamp. You take the calcium at 1,000 milligrams 3 times a day, and the vitamin D. It's amazing how many alternatives there are when you start shying away from just applying your rubber stamp.
On the flip side, I hadn't really been familiar with vitamin D toxicity until I met you.
Yeah.
So we got to be careful of that too.
Yes.
There is such a thing as too much of a good thing.
That is correct, yes.
Yes.
With regards to me, I've tried different type of hormone replacements. I've, again, I had my full hysterectomy and didn't want to be on any hormone replacements because my aunt could develop breast cancer. So you get all that fear of it, right? Not knowing what you should do. But anytime I would try to do something, whether it be, a cream or anything like that, my symptoms would go off the Richter scale. So without it, my hot flashes would be okay, hot flashes, but they wouldn't be really bad. The minute I was on the cream, my hot flashes were ridiculous and happening a lot. And even like Kimber's given me some supplements here. And when I take them, immediately I have a massive, it like heightens things. She had given me something for my hot flashes that were coming so bad, and I ended up with massive headache. I mean, absolutely massive headache. So it's like, can your body just freak out because it hasn't had something and you're putting something in there? Because how you were talking about microdosing is, how do you know? Because like I said, I've done the hormone test. They've said, do this, and my body just freaks out the opposite way. So then I stop.
So how do we know is basically you're telling us something is not quite right and the usual approach doesn't work with you, and therefore it is much better to start from the lowest intervention possible and slowly bring that up. And that's why, supplements and Chinese herbs and all these type of things might be your best choice, because obviously you're much more sensitive than the usual Josephine Schmo out there. And therefore, we need to listen. In other words, you also need to provide us with that information. So if you have the time, write down what you took, write down what you have experienced, and even if it's 10 pages, it is important, because there might be that one line that clues me in. Aha, here we are. And so this is going to be our approach.
The other thing, not knowing you yet, another benefit within Healing Horizons is that we collaborate with one another. And so it would be amazing for Kimber and I to sit down and look at your case together, for me to meet you more one-on-one and get your health history from my perspective, because no one practitioner can get all the information that is going to be best for your care. That's the beautiful thing about us working together is I might pick up on something that Kimber doesn't, or vice versa, or Dr. Bechstein, or Dr. King, or Dr. Hawthorne, or Joseph Ellerin, our homeopath, because I get a lot of clues listening as a practitioner. I'm thinking, I wonder if that could be because, you're having I'm calling you opposite girl syndrome. What's going on? What's going on in there? And maybe I might think of some questioning that might go on a different level than you've had so far. And then we can try to gear you toward the right direction, or just keep guiding you and molding you in a way that's going to fit for you. Because this just if anything comes out of this talk is for all of us to know that we're all different, and each one of us are different. And you might be even presenting even a textbook Chinese medicine in terms of your tongue and your pulse and your symptoms and herbal and still be responding differently. That means we've got to look even deeper than that. And so I would say, let's keep digging.
Yeah.
And figure it out. Yeah.
I like how you said that opposite, because even with Joseph, he was like, okay, I think this homeopathic is going to hit you and it's going to be great. And I mean, he felt really confident. I took it and I was like, yeah.
Okay. So I said we would circle back to BioWell, and it's coming quite naturally, because this would be the perfect scenario to consider the BioWell machine. And the BioWell is something that I will let Dr. Bechstein explain, but it is helpful for Chinese medicine practitioners, especially because it does measure your meridians, and also brings into other measurements like your chakras and so on. And it might give you some information that you might go, oh, I just said I had one aha moment. I've had a couple others since we've been sitting here. I'm like, I love those light bulbs. They keep me going. And you might have some light bulb moments, and you might go, oh my goodness. For example, with another client who did a BioWell, and she was like, it said this was way over here. And I got to thinking, oh yeah, I had this incident 20 years ago. And ever since then, I've had this, and this, and we've missed it because we just hadn't uncovered it yet. So that might be helpful. What is the BioWell?
So electrophotonic imaging is basically the principle, and I don't know if any of you have seen Kirlian photography. That's 100 years old, and it is basically, when you see pictures, it's that leaf that has an aura around it or an energetic field around it. That gave rise to scientific measurement in human beings. And what we do is we use the fingertips, and electrophotonic imaging on all 10 fingertips has been researched. What kind of a picture do you get? Over the last 50 years, this particular outfit that I'm using, which is called BioWell, has done all that research to try and put together how this fits into your energetic profile. Now, we're talking about energy. We're not talking about hormones. We're not talking about electrical systems in the body. We're talking about the energy and how it flows through your system. And that can be picked up, and it will tell you if there is flow restrictions to your liver or your whatever. And that's what then prompts the question. And that's why this particular patient then said, light bulb, oh yeah, this is 20 years ago. Never anybody would have thought to ask questions in that department because it's been so long ago. But evidence of this is still present in the energetic profile that we measure. And so we can home in on that and hopefully make life better.
Great question. Thank you. Any other questions or comments?
Are you here in the building, or
Yes.
do you have another office?
No.
Oh, okay, good.
That room over here.
Gaia, also psychological, like what could have happened either way? Like psychologically and physically, or does it measure both of those things?
So when we're talking about energy measurement, we're leaving all these thoughts behind. This is basically the yin yang is a refinement of the energy in your system. And Dr. Schulte knows a heck of a lot more about it, but at least I can measure it.
Yeah.
Okay.
I'm thinking back to my own BioWell experiences so far, and the way I would say it has helped me, for example, is my liver energy, I think it was skewed,
Mm-hmm.
and you can really see it. And I'm like, no surprise there. And because the liver in Chinese medicine courses the qi throughout the body, its job is to make sure the qi is flowing smoothly. And when that qi becomes stuck, it can wreak havoc in different areas like digestion, anger, gallbladder problems, depression. And it often happens when we have unfulfilled desire. Okay, so when we understand which emotions are related to that particular organ, in that way, it can help us unfold what might be going on mentally, emotionally. Does that answer your question? Yeah, great.
I have struggled for probably 20 years with insomnia, and I was on temazepam for years and years, which I know was really not a good medicine. Weaned myself off of that. But now I just still didn't sleep when I wasn't taking anything. So now what I do is I take gummies, and I'm finding that I started, of course, on, 5 milligrams, and I'm now up to 25. And it really makes me very anxious to think about not taking anything because I know that I work.
Sure. Yeah.
Is that something that you guys would work with then? Because I think I have really looked at all of the hysterectomy treatments for insomnia. Progesterone didn't work. Temazepam, of course, works, but it's so dangerous. The gummies work, but they're very expensive, and
you're needing more.
And I prefer not to take them.
Yeah, so when you say gummies, it's basically, we're talking about either THC or CBD or terpenes, all these type of things. That is associated with what we call the endocannabinoid system. So we do have receptors to THC, believe it or not. It's not like alcohol that just goes everywhere and does its thing. We are designed, and we do make our own hormone that occupies these receptors, and we can use external supplies to influence the endocannabinoid system. And that, a lot of people rush in there and they do the knockout gummies or whatever, a certain mixture of THC and CBD. That is because this is an infancy situation here. We are at the beginning of understanding the endocannabinoid system, and most people basically, here again, overdose. It is there again a question of what are you taking, how much, what are the ingredients in there, what's the different composition of these ingredients, and are you doing this correctly or not? So.
And my answer to that would be that, it sounds to me like you have the question, just to reiterate, is how to help insomnia. Basically, you've tried lots and lots of different things, and it just isn't quite working at this point in time, and you've been trying for 20 years. And I'm hearing from you that you've tried multiple tools already. You've already tried different things to try and help yourself. And what I would encourage is a differential diagnosis from someone like me as a Chinese medicine practitioner, because we're going to look at everything together. So we're going to look at the yin and yang balance, understand not just in general, but in each organ. And then with insomnia, and I understood that nothing's going to freak you out more than not being able to sleep again. And that just makes it worse. So I certainly can understand that. And we were talking about yin deficiency. Well, one thing that really feeds the yin is rest. And so if you have yin deficiency and you don't have enough yin to suppress the yang so that you can sleep, and you're unable to sleep, then that discrepancy grows between yin and yang. And I have absolutely no idea if this is your situation at all. It's just one example, because I could have 10 different people with insomnia and then 10 different treatment plans, because each of us are unique with different pictures. But let's say this is the scenario. What do most people need to do to get through the day if they didn't sleep? What would they do? Coffee. Oh, okay. Coffee. Wow. Sounds great in the moment. We're sleepy. We want that hot, warm drink. But what does it do? The coffee bean itself is very hot natured. So everything that we eat and drink and ingest has a nature associated with it. It can be cooling, cold, neutral, warm, hot. Okay. And coffee bean is hot. It is very hot. And what happens is it depletes the yin because it consumes the yin. It's so hot, it eats it up. Okay. Meanwhile, so I describe this as a dry piece of wood. Okay. In that scenario, you drink even, people say, oh, I just have 1 cup in the morning. Yeah. 1 cup and 1 sip of alcohol in this, and you turn into a hot ball of flame. Hot heat rises, and now you are just in trouble. And then the nighttime comes, the sun starts to set, and we want what? The yin energy to calm down and quiet the yang so we can sleep. But you don't have that blanket to go over the fire, and so what happens? It just gets worse at night. So the answer usually is, in that scenario, well, what can we do to build the yin? So, and that's all encompassing. It's not a hormone. It's not a substance. It is a very well-rounded plan of action that involves lots of things like eating different foods, eliminating different foods. Maybe some people, it might, if you're so much suffering, you might need some hormones or something at first so we can work on some of these underlying issues. Or some people, they've had a trauma and you didn't think about like a trauma. And then we say, well, we've never been well since X, Y, or Z. Like, well, I always ask, when did you start not sleeping? 20 years ago. What was going on in your life 20 years ago?
I had a fairly severe closed head injury.
Okay.
Ended up at St. Mary's for 3 weeks.
Oh, at this point in time, not that I don't care, because I certainly do care. And I would say, oh, this yin yang, blah, 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 can be super helpful. I would immediately refer you to Joseph Ellerin for homeopathy, because that is, whenever we've had a head trauma and we have symptoms, we say, I've never been well since a head trauma. I've seen homeopathy do amazing things. It feels like magic. It's treating the body all the way back to that trauma, and we can restore balance when we get the remedy right. And so and that's what we just keep looking. We don't give up, right? Like, you're not giving up. You're here tonight. And then we're getting more answers, and we just keep the digging and peeling the layers off until we find it. And the answer is always there. It's always there. And so it's just a matter of how steadfast are you to keep looking, and how steadfast is your team of people to keep working on your behalf. But if you can say you've never slept well since that, I would say, please schedule with Joseph Ellerin. You'll thank me later.
And that is the beauty about working in concert here, because, you wound up on a medication that is highly addictive, that usually requires more and more over the years. And coming off that medication, you need to slowly taper, because if you don't do it right, there is serious consequences of that. So it's fantastic to be able to have a team of people that are going to be able to get away from this type of behavior and actually treat you the way your body would want you to be treated.
And if you don't live here in Grand Junction, or you're somehow opposed to Healing Horizons in some way, I would say develop your own team of people. That's how I developed Healing Horizons, was as a sick patient. I was a sick person and I really wanted some help. And luckily, I am so interested in health. It's my jam, because it really gives me fuel in life. I love it. And so I felt the challenge. I'm like, okay, I'm going to see this provider and I'm going to do this. And that'd be cool if we combined it with this modality and that modality. And I started seeing how, when we really want to address any symptom of the body from a physical, mental, emotional way, okay, together, and then each practitioner has something different to offer, and then they collaborate on your behalf, or you start putting the pieces together instead of just leaning on one modality, one pharmaceutical, one Chinese herb. Instead, we combine everything. That's how we actually are going to achieve health in life. Okay, that's my biggest message. If you don't live in Grand Junction, put together your own healthcare team. Find people you trust. Find practitioners you connect with. and then branch out, and then be your best advocate, your own best advocate, and ask them to communicate with one another.
That is the trick of the trade, and that is very frequently dropped in my realm of things. And that is the big problem. If you don't communicate, you won't know that there's another avenue available for that particular patient, and you're frustrated, you're pulling out your hair, and you're prescribing more medication.
Well, and once they've treated you, they're done with that. So it's not like you can go back and say, well, this isn't working or whatever. And now you're going to say, well, that's what we can do.
Well, that's a fact.
This is good to have all of this.
Yeah, exactly.
Because you don't have it out there.
Right.
You just don't.
We recently recorded a podcast together as well, and it was so great because I was defending his mode of healthcare and he was defending mine. I'm like, this is cool. And, you know, the healthcare system is not built in such a way that they have the luxury of really listening, unfortunately. And so it is up to us as patients to change it. And we change it by not standing for it anymore, by really taking the reins in our own healthcare and saying, well, I'm going to do it my way. And that's how we're going to do this. Because you are actually the boss of your own health. You are the one who gets to do it. It's not up to anyone else but you.
And I might be, an outlier in that department in terms of me really embracing this. But there's more and more practitioners that are realizing that there's value. And I see that in notes when physicians collaborate. You see how they manage their patients. And all of a sudden I see sneaking in that, somebody over there is referring to Dr. Schulte, In the olden days, that was an absolute no-no, and I see it more. So in other words, there is an awakening out there, and I want to push that.
Yeah.
So where would you recommend to start? Like Harriet said with her situation, and do we start with that bio first, or she just goes straight to Joseph?
It's a great question. I would, you could start with almost anyone here and we'll guide you in the right direction. However, I would go to where your intuition say, I've never tried acupuncture. She sounded pretty cool. I'm going to give her a try or whatever. Or you'd be like, you know what? That BioWell sounds amazing. I want to try that. Either way, if you ask us to collaborate, we will. And then we really want to find the most efficient way of care for you. And I just know for sure if you see me, I'm going to do it. So I know for sure I would get you directed the right way to go. And it can't hurt you to see literally anyone here because someone has something to offer. And then just ask, I'm here, I'm going to try this. What else could I try? And then have discussions. And we're also happy to field some calls, about questions so we can help guide you. If you don't know where to start, we can help guide you before you schedule as well. Yeah, great. I'm so grateful you all came and such great questions. Anything else before we close for the evening? Okay. Thank you so much.
Great.
And
Yeah,
thanks
thank you for
everybody
coming.
online. And
we'll be available for answering questions if any of you were too shy to do it in public.
this was so much fun. Thank you.
All right. Thank you.
So, like,